to contribute to this rich and important debate, and particularly to speak to the amendments 10 and 13 that appear in my name. I would just comment on the words of the noble lady Baroness Meacher about the importance of public health, and stretch that much more broadly than the examples that she gave, in that it really ties to the previous group where we were talking about how climate change and the nature of the environment are related to health. And a public health approach really is talking about ensuring that we have a healthy environment, that we prevent illness, prevent malfunction. And if we don't have that approach on the ICBs, I think that's a real problem. I'd also comment on the words of the noble Lord Bradley and agree that the Government Amendment 31 is useful but not sufficient to deal with the issues that are raised by this group of amendments. And just to say that the Green Group very much agrees with both Amendments 9 and 12 and will be supporting them should we get to that point. I should perhaps declare at this point in the debate that I'm a Vice President of the LGA and the NALC, which may be considered relevant here. But what I'm speaking to are the two Amendments 10 and 13, and to declare exactly where I come from, it was the Royal College of Nursing who came to me and said they really thought these amendments should be here. It persuaded me of the case, and it's very much their case that I'm now about to present. And to begin with a little bit of history, as part of the statutory regulations of the Health and Social Care Act 2012, it was mandated that registered nurses would be part of the Clinical Commissioning Group governing body. And if we look at the regulations, National Health Service Clinical Commissioning Groups 2012, Section 11, the membership of the CCG governing body has to be at least one registered nurse within its membership. This will be lost if this is not required within the leadership of the integrated care boards. Now, I think this ties to a point being made by the noble Lord Bradley, that sometimes there are very powerful forces in medicine, and indeed this also relates to the points made by the noble ladies Thornton and Brenton of the powerful force of private interests in medicine. Other truly important voices often get swept aside. And it is worth noting that around in the NHS in England, registered nurses are more than 49% of all professionally qualified clinical staff. They have a unique relationship with patients and clients that gives them an insight, a different kind of insight to other professionals into how the service works, and ensuring that measurement of performance is one that reflects the interests of patients and clients. I think it's representative volume terms alone, the case here is very clear. Registered nurses lead, innovate and deliver the largest proportion of care, and their leadership brings critical expertise, advice and challenge into boards. Without this clinical leadership, there's a risk that service design and delivery become a matter of financial accounting without proper attention to the quality and outcomes for patients and clients, or indeed that there's a real focus on what I might describe as the heroic type interventions rather than the day-to-day care, and indeed, as we saw a lot of debate in committee, the importance of rehabilitation, which is an area where I think registered nurses bring particular skills. So, my Lords, it's not my intention to move these amendments, but I really do hope that the government will be listening to the case being put by what is, of course, a hugely important professional body and a hugely important body of professionals, and that we see action taken after this debate to make sure that the registered nurses are represented.